Today we will start topic of lower limb popliteal fossa. Popliteal fossa is the diamond shaped space which lies behind the knee. This is the popliteal fossa, that is the diamond shaped fossa or the space. It is the intermuscular space. Which is the most prominent when the knee joint is flexed. Cutaneous supply of this area is done by the posterior cutaneous nerve of the thigh. Now we will continue, that is the popliteal fossa. First of all we will talk about the boundaries, then we will talk about the content and then the applied anatomy. This yellow area shows the popliteal fossa, that is a diamond shaped fossa. First of all we will talk about the boundaries. That is the above and medially, that is a superomedially. It is formed by the two important muscles, semimembranosus and the semitendinosus. Muscle. And above and laterally, that is the superolaterally, it is formed by the long head of the biceps femoris muscle and the short head of the biceps femoris muscle. Below and medially, it is formed by the gastrocnemius muscle. Gastrocnemius muscle have a two head, medial head and the lateral head. So medial head of the gastrocnemius form the boundary, that is the inferomedially. Next, below and laterally, it is formed by the lateral head of the gastrocnemius muscle. It is supplemented by the plantaris muscle. This is the boundaries of the popliteal fossa, that is the diamond shape. Superomedially, semimembranosus and the semitendinosus. Superolaterally, long head of the biceps femoris, short head of the biceps femoris. Inferomedially, that is formed by the head of the medial head of the gastrocnemius, and the inferolaterally, it is formed by the lateral head of the gastrocnemius, and it is supplemented by the plantaris muscle. This other diagram showing the popliteal fossa, that is the semimembranosus, semitendinosus, biceps femoris, short head and the long head, medial head of the gastrocnemius and the lateral head of the gastrocnemius. This is the boundaries. Next we will talk about the roof of the popliteal fossa. Roof of the popliteal fossa is formed by the first of all skin, superficial fascia, then deep fascia. This is the deep fascia. Next, small saphenous vein and the posterior cutaneous nerve of the thigh. In the center, this is the posterior cutaneous nerve of the thigh, and this is the posterior division of the medial cutaneous nerve of the thigh, and this is the lateral cutaneous nerve of the calf. So, roof is formed by the skin, superficial fascia, deep fascia, small saphenous vein, posterior cutaneous nerve of the thigh, posterior division of the medial cutaneous nerve of the thigh and the lateral cutaneous nerve of the calf. This is the roof. Again, very important structure in the roof, that is a peroneal communicating or the sural communicating nerve, which connect the sural nerve with the tibial. That is the other diagram showing the line diagram, that is the roof of the popliteal fossa. Deep fascia, posterior cutaneous nerve of the thigh, this is the saphenous vein, this is the posterior division of medial cutaneous nerve of the thigh, this is the lateral cutaneous nerve of the calf. That is a roof. Next we will talk about the floor of the popliteal fossa. Floor of the popliteal fossa is formed by first of all, that is the above posterior surface or the popliteal surface of the femur. Next, capsule of the knee joint and the ligaments and the below fascia covering the popliteus muscle. This is the tendon of semimembranosus and this is the oblique popliteal ligament, which again form the floor of the popliteal fossa. So, above to downward, floor of the popliteal fossa is formed by the popliteal surface of the femur, capsule of the knee joint oblique popliteal ligament and the fascia covering the popliteus muscle. This is the flow. Now we will talk about the content of the popliteal fossa. Content of the popliteal fossa. This is the again diamond shaped space, popliteal fossa. In the popliteal fossa, that is a very important structure, most medially, that is a popliteal artery, then the popliteal vein, then the tibial nerve. This is the common peroneal nerve. Tibial nerve and common peroneal nerve are the branches of the sciatic nerve. These are the very important content. Along with these content also present, this is the posterior cutaneous nerve of the thigh, which form the also roof of the popliteal fossa, genicular branch of the obturator nerve, popliteal lymph node, popliteal fat. Again, I am telling about the content of the popliteal fossa, that is a very important. Popliteal artery, popliteal vein, tibial nerve, common peroneal nerve, and posterior cutaneous nerve of the thigh, genicular branch of the obturator nerve, popliteal lymph node and the popliteal fat. Now we will talk about the relation of the vein, artery and the nerve in the popliteal fossa. This is the nerve, vein and the artery. This is the lateral, this is the medial. First of all, we will talk about the relation of the vein, artery and nerve in the upper part of the popliteal fossa. Most laterally, it will be tibial nerve, then popliteal vein, then popliteal artery. Then that is the mnemonic AVN. From medial to lateral, artery, vein and nerve. Next, in the middle part of the popliteal fossa, relations from superficial to deep, tibial nerve, popliteal vein, popliteal artery. This is the mnemonic NVA. Superficial to deep, NVA. Nerve, vein and artery. Next, in the lower part, that is the a medial to lateral. NVA. Mnemonic NVA. Tibial nerve, popliteal vein and popliteal artery. So, in this popliteal fossa, there are the very important relations of the vein, artery and nerve. Most medial in the upper part, artery, and in the lower part, that is the most medial nerve. This is the relation in the popliteal fossa, upper part, middle part and lower part. This is the next we will talk about the detail about the content of the popliteal fossa, that is the first content, popliteal artery. Popliteal artery, which is the continuation of the femoral artery at the adductor hiatus. It is enter the popliteal fossa on the medial side of the femur. This is the popliteal artery. Popliteal artery is the continuation of the femoral artery at the opening in the adductor hiatus. It terminates at the distal border of the popliteus muscle and divide into two important branches, anterior and posterior tibial artery, which are the arteries of the leg. Relation I have already talked about. This is the adductor magnus, this is the adductor hiatus. This is the opening in the adductor magnus. Here is the femoral artery continue as a popliteal artery. This is the popliteal artery. This is the popliteus muscle. At the lower border of the popliteus muscle, this popliteal artery divide into anterior tibial and the posterior tibial artery. This is the popliteal artery. Popliteal artery have many branches in the popliteal fossa which supply the surrounding structure. First branch, that is the superior genicular artery. These are the medial and lateral superior genicular artery, middle genicular artery, inferior genicular artery, medial and lateral, muscular branches which supply the adductor magnus and the hamstring muscles, cutaneous branches which supply the skin on the back of the legs, small arteries which supply the gastrocnemius, soleus and the plantaris. Here diagram showing this is the adductor hiatus and here is the posterior tibial artery, this is the anterior tibial artery. Superior medial genicular artery, superior lateral genicular artery, This is the middle genicular artery, inferior medial genicular artery. This is the inferior lateral genicular artery. These are the muscular branches which supply the gastrocnemius and the other muscles. This is the very important branch, that is the sural branch, and that is the last terminal branch, peroneal. This is the branch of the posterior tibial artery. So branches of the popliteal artery which take anastomos around the popliteal fossa. Next, other content, popliteal vein. Popliteal vein is formed by the vena committant of the anterior and posterior tibial artery at the distal border of the popliteus muscle. So it starts from the distal border of the popliteus muscle by union of the two vena committant, anterior and posterior tibial artery, and it enter into the popliteal fossa and the ascend through the popliteal fossa, opening in the adductor magnus, where it become the femoral vein. Many tributaries of the popliteal vein: small saphenous vein, vein corresponding to the branches of the popliteal artery, muscular veins, including a large branch on each of the gastrocnemius. This is the popliteal vein. Popliteal vein. Here is the anterior tibial and posterior tibial vein, vena committant, and joint from the popliteal vein at the adductor hiatus. It continue as a femoral vein. This is the popliteal vein. The very important tributary, that is the small saphenous vein. Small saphenous vein. Now we will talk about the next content after the popliteal artery, vein, and nerve. Now there is a two important nerve, tibial nerve and the common peroneal nerve. Tibial nerve, that is a branch of the sciatic nerve. It enter into the popliteal fossa and at passing behind the soleus muscle to become the posterior tibial nerve. This is the tibial nerve, enter into the popliteal fossa, and here is the two head of the gastrocnemius. It passes behind the soleus muscle. Branches: sural nerve, muscular branches, head of the gastrocnemius, plantaris, soleus, and the popliteus muscle. Articular branches: superior medial genicular, inferior medicular genicular, and the middle genicular nerve. These are the articular branches which supply the knee joint. This tibial nerve terminates at the level of the sole of foot and divide into medial and lateral plantar nerve. This is the branches of the tibial nerve. Next, sural nerve, that is the again along with the saphenous vein and supply the side of the lateral side of the foot. This is the sural nerve. Next, common peroneal nerve. Common peroneal nerve, that is the again small terminal branch of the tibial nerve. It enter into the popliteal fossa and it is closely related to the medial border of the biceps muscle, biceps femoris muscle, and it enter into the biceps femoris muscle के along चलेगी. Then it leaves the fossa by crossing superficially the lateral head of the gastrocnemius, and then it passes behind the head of the fibula. Behind the head of fibula. That is the head of fibula, and this is the neck of fibula. Then wind around the neck of fibula. Neck of fibula. Okay. Then it supply it divide into superficial peroneal nerve and the deep peroneal nerve. This is all about tibial nerve and the common peroneal nerve. These are the branches of the common peroneal nerve: sural communicating nerve, lateral cutaneous nerve of the calf which supply the skin on the lateral side of the back of leg. Muscular branches which supply the very important muscle, short head of the biceps femoris muscle. Articular branches: superior lateral genicular nerve, inferior lateral genicular nerve, and the recurrent genicular nerve. This is the common peroneal nerve. This is the biceps femoris. It runs along with the medial side of the biceps femoris muscle. Then it goes near to the head of fibula and then the neck of fibula and supply the back of side of the leg. Popliteal lymph node is the last content of the popliteal fossa. There is a many number of the lymph node which receive the superficial lymph vessels from the lateral side of the foot and the leg. popliteal lymph node. These are the popliteal lymph node which runs along with the small saphenous vein, popliteal lymph node. Now we will talk about the clinical popliteal artery we can palpate behind the knee after pressing in the center of the fossa. Next we can again measure the blood pressure by the popliteal artery. Next, popliteal aneurysm. There is a dilation in the popliteal artery, that is known as a popliteal aneurysm. And Baker's cyst, that is a collection of the synovial fluid that has escaped from the knee joint or a bursa, that is formed by the new synovial fluid. Foot drop, that is the injury in the common peroneal nerve or the deep peroneal nerve, that is known as a foot drop. That is the foot drop, injury in the common peroneal nerve. So this is all about your popliteal fossa. So popliteal fossa is the diamond shaped space which lies behind the knee, which have a very important content: popliteal vein, popliteal artery, and the tibial nerve and the common peroneal nerve. Very important contents. This is all about your popliteal fossa. Thank you for listening to me. Thanks.